I'm joined today by Dr. Kevin Johnson. Dr. Kevin Johnson is a featured KHQ medical partner. You are also the owner of Dr. Kevin Johnson's Advanced Aesthetics, with 2 locations, one here in Spokane as well as one in Coeur d'Alene.
Right.
I want to talk about, you say that you offer minimally invasive procedures. You really pride yourself on using the latest, most advanced technology. Talk about these advances in technology recently that have allowed you to do procedures for people that are less invasive, less painful, less downtime.
Right, yes. I think the way cosmetic surgery is moving now is that people are looking for procedures that are not only very effective, but also have very little downtime. It's more of a fast food society that we live in. People would like to do these procedures, but they would like to have minimal recovery, be able to get back to work quickly, and have a great result still. So the technology has really changed. I think we're really moving towards procedures that can give a rejuvenation. I think we start with the skin, and skin rejuvenation procedures are pretty important and as a foundation. And so lasers really have allowed us to do some pretty aggressive and impressive treatments for people, but give a very small downtime. I think the other issue is scarring. People really don't, when they have a cosmetic procedure, they really don't want to scar if they can help it. And a lot of times we can give these procedures and allow people to recover and have a nice result without a scar.
I want to show some of the photos. We have a few before and after photos. I believe, is this a smart lipo procedure that we're going to look at?
Yes.
I was really shocked when I saw these because I was like, oh, this is probably multiple procedures of something. But this person went through one procedure, and the results are astounding to me. Like you said, hardly any scarring. Talk about this procedure, the liposuction that you do, and how it differs from the traditional liposuction that we've all thought of for years.
Sure, yes. This is smart lipo, and this is probably the most common procedure that we do. We're probably one of the busiest smart lipo practices in the area. And this is an awake procedure. So compared to someone being put under general anesthesia, asleep, having to recover from anesthesia, with the side effects with that, and also just dealing with the swelling and bruising that was traditionally the case in standard liposuction. This is done with a patient completely awake. We give them pills for sedation. They're comfortable but relaxed, and then we use local anesthetic. It's called tumescent anesthesia. It's a local that is pumped into the whole area that we're working on. Then we augment the procedure with a laser. So the smart part of smart lipo is actually using a laser under the skin through the fat. It melts fat, coagulates blood vessels, and it helps tighten the skin, which is really a neat adjunct to the procedure. People don't want to look deflated. They don't want to look like saggy, but then they want to have some tightening. So if we remove the fat and get the skin to tighten at the same time, that's an added bonus.
Yeah, those pictures are really awesome to look at. Anyone would like to be able to get rid of the fat in their problem areas. You do say, though, that you don't put people to sleep. They don't have to go through the general anesthesia. That's going to scare some people because some people are like, well, I don't want to be awake. Talk about, though, the benefits of that, because general anesthesia has more possible complications. It can be a little bit more dangerous, right?
It can, and I as a surgeon, we have people under general anesthesia all the time, and it is in general a very safe thing to do this day and age. However, if you can avoid the small risks, the potential risks associated with general, it's a bonus. People don't have to wake up and feel nauseated. They don't have to have the headache and feel crummy and tired for several, sometimes weeks after having a general anesthetic. Doing this as an office-based procedure allows people to come in and out and not have to deal with the red tape and the difficulty with going into a hospital and getting checked in and out. People are very safe during this procedure, and because of the fact that they're awake and not under, and the fact that they're breathing on their own and feeling good, and the minimal side effects associated with these pills, the recovery is so much quicker and they feel so much better afterwards.
We talked about the smart lipo. Another one of your specializations is laser cosmetic surgery. Is that basically the same idea of using a laser as you're going in and doing these cosmetic procedures? Explain that.
Yeah, lasers are great tools, and I think the modern cosmetic practice has incorporated, most practices have incorporated lasers in some way to augment the things that we can do for skin. Lasers are really designed, they're great for skin rejuvenation and tightening, treating fine lines and wrinkles. We can treat small blood vessels, the little vessels on the face or the legs, and can get rid of brown spots as well. So all the cosmetic blemishes and things that people have, is scarring, acne scarring, things like that can be treated. And so that's, I think that's the really what we try to focus on. We try to focus on the minimally invasive procedures that can give people a visible result, and lasers have gotten better over time. The technology has changed even since I've started doing this, and it's really fun to work with lasers and also teach about them as well.
Well, you talk about skin, and I feel like that really is the most important thing when it comes to feeling good about yourself. You can lose weight, but if you have saggy skin, you're not going to feel great. Scarring on the face. I have struggled with acne for a long time. Let's talk about some of the facial procedures that you do. I know I saw an interesting word on your website, something with a facelift and water.
Oh, liquid facelift?
A liquid facelift, thank you. Sorry, I lost the word there, but what exactly is that?
Well, if you look at, whenever we evaluate someone's face, people have a very constant way of aging. As we all get older, we all continue to have birthdays, and I just had one. It really is something that changes in everyone, and we lose volume for one thing. We lose volume in certain areas in the mid face, and then we get lax, the skin laxity. It gets thinner, and the skin starts to sag, and so our faces change shape. They go from a triangular shape when we're younger, we call it the triangle of beauty, to more of a square shape. And as things kind of move down, so your face versus my face, for example, you got the triangle and I got the older. So what happens is that we try to change the things that have changed with aging. So we try to improve the quality of the skin itself, to start with that. But the other very specific changes are volume changes. So in the mid-face, for example, up in the cheeks, we get hollow, we get flat, and we lose volume and start seeing dark circles under the eyes, and it just looks a little more flat as an older person. So we bring the volume out and volumize the cheeks and kind of create this widening of the upper mid-face. Also around the mouth, you can see older people, they have what looks like a frown. The corners of the mouth start to droop, and we can bring those up with dermal fillers like Perlane and Restylane, and also use neuromodulators, Botox, Dysport, those types of medications to help relax muscles that are creating these frown lines. So I think really where cosmetic surgery is going, and what we try to focus on in our practice, is getting away from facelifts. People think, well, I need a facelift. What can you do for me? Well, a facelift involves surgery, it involves scarring and recovery, and most of the people that come to see me in my practice say, that's just too much. I don't want a facelift.
It's very invasive.
It's an invasive procedure.
So to be able to get all of the things we don't like about ourselves, to be able to get them in a much less invasive way, so that you can be back at work and not have to hide your face, feel better about yourself. It's absolutely great to be able to have these available to us today. I do want to mention a couple things. As you're listening, you probably have some questions about, I wonder if you could help me with this problem area. You offer free consultations to anyone. So anyone can call either location, Spokane or Coeur d'Alene, to get a free consultation. And you are also going to be on The Doctors, May 6th. Can you give us a little sneak peek of what it's going to be about? Well,
it was kind of an interesting thing, and it was a huge honor to be asked to come down to Hollywood and film a segment for the show. It was a lot of fun. But there's a patient that had written in, and they invited her to be on the show, and then they were looking for people in the area. There was a local patient, and they were looking for providers in the area that could help her with some of the cosmetic needs, and one of the needs was laser hair removal. And so they asked if we would be interested in helping this patient. We said, absolutely. This sounds like fun, and so the show is about providing laser hair removal and a specific condition called polycystic ovarian syndrome, which results in excessive hair growth. And so it was fun. It's neat to be able to help the patient, but also just to kind of see what happens behind the scenes in Hollywood and in these big shows. Yeah,
actually meet the people that we all watch every day in our living rooms. So thank you so much for coming down and talking about everything that you do for us. Again, you can get a free consultation just by calling either number. I'm going to give them to you really quick. 855-375 3846. They're on your screen there. You can write them down. That's the Spokane location. Coeur d'Alene is 208-676-8346. Also, check out Dr. Kevin's website. You can go to www.advancedaestheticsmd.com.